my name is Emily. I'm a nurse practitioner student at St. Anthony College of Nursing. So just before we begin, I want to let you know that this conversation is going to be completely confidential. It's just for educational purposes. Just myself and my professors at school will be viewing this videotape. So today we're going to be doing a full health history and review of systems. I'm going to be asking you quite a few questions, so if at any point you feel uncomfortable answering anything, just let me know and we can skip it. And then also, if you don't remember a specific date, an estimated date is completely fine. So I see your name is Octavio. Is that okay to call you, or do you prefer something else?
That's perfect, Octavio.
Okay, perfect. So, what has your experience with nurse practitioners been in the past, or what's your understanding of the nurse practitioner role?
I don't think I quite know their role.
Okay, so a nurse practitioner is essentially an advanced practice nurse. We work alongside a medical doctor. We're able to treat, diagnose, prescribe, and see our own patients. Okay, so just to confirm some basics, what is your full name and date of birth?
My name is Octavio Galvez. My date of birth is September 9th of 1999.
Okay, and that would make you 26?
26.
26, great. Okay, so and what is your address?
It's 5075 Rocky Lane in Lovis Park, Illinois.
Okay, and your phone number?
815-319-0401.
Okay, great. And what sex do you go by?
Male.
Okay, and your race?
Hispanic.
Okay, and would you say you're single, married, or widowed?
With a significant other.
Okay, perfect. Is she your age?
She is 24, I believe.
24,
yeah.
Okay, and what is your current job?
I am a general contractor.
Okay, and is that your usual job, or have you switched jobs recently?
No, that's been my job for a while.
Okay, have you had any other jobs in the past?
I've had out of high school, I had a couple jobs here and there.
What jobs were those?
Worked at an airline, and I did mowing services for a water plant company.
Okay. Okay. Did you do that for a long time then during high school?
I did it about a year each, and then after a couple years, I went to my existing job, and I've been there ever since.
Okay, sounds good. Perfect. So next question I have for you is, what's your usual form of healthcare? Like, so do you go to a primary care clinic, an urgent care, emergency department?
A primary care.
Okay. Is it here in Rockford?
Yes.
Okay.
It's Swedish American.
Swedish American. Okay. Do you see them regularly?
I see them every couple years.
Okay, perfect. And then do you feel comfortable, or do you feel like you're a reliable historian, or does anyone help you with getting to appointments, or do you feel like you'd be able to recall your health information accurately?
I believe I'm adequate enough.
Okay, perfect. So what's the reason for your visit today?
Just a routine checkup.
Okay, so you are here for a routine checkup.
Correct.
Okay, so we're going to move on to your present health status. So what was your last visit that you saw a health care professional?
I believe, back in 2020 during COVID.
Okay. And what was that for?
It was to get the COVID shots.
Oh, okay. And I'm assuming you got that. Have you gotten any more after that?
Not after that, no.
Okay. Any chronic illnesses that you have been diagnosed with in the past?
No.
Okay. Do you have any history of mental illness, or have you seen anyone?
No.
Okay. And then do you have any concerns that you want us to address today, or something you want me to focus on?
Not anything in particular, just make sure that I'm okay.
Okay, great. So let's move on to your immunization status. So I'll list these, and again, if you don't remember exact dates, a great estimate is fine. So a tetanus shot, have you ever gotten one before?
I believe no.
Okay, this is that shot if you were to step on a nail or be bitten.
Okay.
Oh, you haven't gotten that one. What about your Tdap?
I have not.
Okay, your flu shot?
I have when I was younger.
When?
I believe when I was in grade school.
Grade school.
So it's been a while, 10, 15 years.
10, 15 years ago. Okay, and have you gotten a pneumonia vaccine?
No.
Okay, and COVID-19 was back in 2020. You didn't get any boosters since then?
No, incorrect. It was 2020.
Okay, perfect. Hepatitis B shot?
I believe not.
Okay. And do you believe you've been exposed to any communicable diseases? This could be like tuberculosis or hepatitis B.
No, I don't believe so.
Okay, sounds good. And do you have any allergies? These allergies could be either seasonal, environmental.
No,
food
no allergies at this time.
No allergies. Okay. What about to penicillin or latex?
No, I believe not.
No. Okay. Have you ever been hospitalized in the hospital overnight?
Last that I recall was I had an incident at my gym that back in 22 that required me to go to the ER.
Okay. Oh, and you stayed overnight for that?
Just for a couple of hours, but that's the last time I went to the ER, like rushed
Okay. Can you
via
tell
ambulance.
Me? Oh, okay. Oh, so it was pretty big.
Yeah.
What ended up happening? Can you tell me a little bit more about?
So I believe, the doctor told me after that I was dehydrated and I was in the steam room. It's like a 5x5 wall, like area where you go in and you kind of just to sweat more and for health purpose, for health to be more healthier with your pores and all that. So I left the room and it was I got dizzy, nearsight, and then unfortunately I passed out, hit my head, and had to get rushed to the ER.
Oh gosh, were you was it in the steam room or did someone help you?
Somebody helped me, but after the fact. So I had already left the area, so I hit my face on the ground, and I required stitches on my nose, stitches on my lip. Yes, it's still visible, and I had a tooth loss. I lost a tooth in the process.
Oh gosh.
Yeah.
Okay.
But that was the last time.
Okay, and that was
2022.
2022.
Fall of 2022.
Okay, and no problems since then. Like, did they do head scans or like?
They did head scans, and they saw that it was all cosmetic. There was no underlying issue, so that was thank God for that.
Yeah, that's good.
Yeah.
Okay. Any past surgeries or procedures you've had done?
No.
Okay. Any injuries or have you ingested anything?
No, none of that nature.
Okay. And as far as medications, do you have anything prescribed to you, or do you take anything as needed, or vitamins, supplements?
No supplements, no vitamins.
Okay. No, like over-the-counter pain medicine or allergy
no,
medicine?
not at all.
Okay, sounds good. Do you do any complementary therapy? So this could be like massage therapy, acupuncture?
No, I don't do any of that sort of thing.
Okay. Okay, we're going to move on to your family history. So this is kind of going to look at the whole family tree. This kind of gives us a good idea because we can see patterns with other family members to see if there's any connections with common diseases. So we'll go through the maternal side and the paternal side. So I'll start with your grandparents. So on the maternal side, are your both grandparents living?
No. My maternal side, only my grandfather.
Okay. And how old is he?
He is roughly 85, I believe.
Okay. And how is his current health?
He's very healthy.
Okay.
He doesn't take any medicine, and he's currently living with my aunts and doesn't require any assistance or any CPAP machines or very healthy. Yep.
That's really good. Yeah. And your grandmother?
She unfortunately did pass away not too long ago, but
Sorry.
no, it's okay. 2021.
How old was she?
I think right about the same age as my grandpa is now. I think she was a little older than him at the time.
Okay. And how did she pass?
She had Alzheimer's. She had heart issues. She had a pacemaker, and yeah, it just deteriorated as time went on, and yeah, unfortunately, but yeah, just Alzheimer's and heart issues.
Okay. Yeah, I'm sorry about that.
It's okay. Thank you.
Your paternal side, are your grandparents still living?
Unfortunately, no. For on my dad's side, they are no longer here with us. No.
Okay. And when did your grandmother pass away on your dad's side?
Around 2021 and 2022, respectively, for both. So not too long ago.
And how old were they both?
They were in their late 80s, 85, 87, I think, respectively.
Was it your grandmother that was 85?
Yeah, so for my dad's side, it was my grandma that was around 85, and my grandpa was around 87.
Okay.
Yeah.
And when did they pass? Or, sorry, what was the reason that they passed?
I believe my grandmother on my dad's side had a heart attack, and my grandpa on my dad's side had a stroke. Yeah.
Okay. Now I'm going to move on to back to your mom's side. Aunts and uncles. How old are they? Or do you have aunts and uncles?
I do. My mother has 4 siblings. She's the youngest of them all, so a total of 5. She's the youngest, like I said. She's around 47, I believe.
Okay.
And then the next from there are mid-50s, and I think the oldest is in past 60.
Are they all aunts?
So it's 4 female and 1 male.
Okay.
My uncle.
And how old are your aunts?
So I believe my aunts are, after my mom, it's around 52, and then the other 2 women are 54. One is 58.
Okay. And your uncle?
Around 55.
55. And are they all in good health, or?
Yes, very good health.
Okay. Do you know if they have any current conditions?
Not that I'm aware of.
Okay.
And yeah, there are no underlying issues.
Okay. What about your mother?
She's very healthy.
Okay. Any current?
No, she eats healthy, exercises regularly, and doesn't smoke, doesn't drink.
Okay. And what about your father?
He's also very healthy.
Okay. How old is he?
He's 45.
Okay. And he's also in good health?
Yes, very good health.
Okay. And any aunts and uncles on that side of the family?
He only has 1 sister.
Okay. And how old is she?
She is, I believe, in past 50, early 50s. 50, 52-ish, I think.
Okay. And do you know anything about her health history?
Oh, she's also very healthy. No underlying issues.
Okay. What about siblings? Do you have any siblings?
I do have 3 younger brothers.
Okay. Ooh, big family.
Yes, a lot of chaos in the house growing up. Good chaos.
How old are your brothers? Are you the youngest, oldest?
I'm the oldest.
The oldest, okay. How old are all of your siblings?
The next one is 20, just turned 21. Will be 20. No, this 21 will turn 22 in February. And then the other two are in high school. One is 17, just turned 17. The other one is 15, just turned 15.
Okay. And how is their health? Any concern?
No, they're healthy. They all work out. They're in extracurricular activities at school.
Oh, what kind of extra activities?
They play football.
Oh, okay, all three of them?
Two. The one in college, who's 21, he is he wants to be a physical therapist.
Oh, awesome.
Related to
healthcare. Yep. Oh, that's great. And then you said football?
Yes, football, and they do track, like running, shot put.
Okay. So now I'm gonna list over. So, like I said, we look at the whole family picture because we are able to look at everything and put together to see if there's any connections with diseases. So I'm gonna list a bunch of different things, and if any of these things you feel that could be related to your family, just let me know. And I'll add
Sounds
that.
good.
So, any allergies in the family?
No.
Asthma?
No.
Hypertension?
No.
Coronary artery disease?
No.
Stroke was with your grandfather on your dad's side.
Correct.
Diabetes?
No.
Cancer?
No.
Cystic fibrosis?
No.
Gastrointestinal disease?
No.
Gout?
What is gout?
Gout is like it's when you eat things, it's like an inflammatory condition.
Oh no, then I believe not.
Renal disease?
No.
Sickle cell trait disease?
No.
Thyroid disease?
No.
Blood disorders?
No.
Is anyone in your family obese?
No.
Any vision or hearing problems in your family?
No.
Genetic or birth defects?
No.
Sudden infant death?
No.
Neurological or seizure history?
No.
Mental health disorders?
No.
Learning disabilities?
No.
And alcohol and drug use
No.
history? Okay. Okay. And then, so I know there's some cardiovascular things that we have in your family history. Are you concerned about any of the mentioned health conditions?
No, I'm not, and I appreciate you going through all the list to make sure that it's not a reoccurring theme in the family. Yeah.
Okay, so we're going to move on to your personal and social history. So I'm just going to ask you more questions. So what is your current living situation?
I am living with my significant other.
Okay, and do you feel safe there?
Yes, I do.
Okay. And how are your relationships with people in your family and outside your family at work?
I'd say very healthy in both work and home.
Okay. Do you do any activities outside of work, like with other people?
Well, I like to go to the gym, play basketball, take out, the missus out or my girlfriend out to a restaurant. She's got friends. I have friends that sometimes we interact with.
Oh, nice. Okay. Here in town in Rockford, or do you travel?
Here in town. Yeah,
In town.
local.
Great. It's hard right now with the cold weather.
I know, yes. Tell me about it.
And what is your work history like? Have you had any injuries at work or been involved in workplace violence?
No, I believe no. I believe not.
Okay. And how do you feel about your finances right now, or do you have any concerns about paying for things?
No, none of that nature.
Okay. And do you have health insurance?
I do.
Okay, perfect. And what is your highest level of education?
I finished high school and a year of college.
Okay. Where did you go to college?
Rockford University.
Okay. And high school?
Harlem High School.
Harlem. What year did you graduate?
I'm class of 2018.
Great. Okay. What you end up going to Rockford University for?
For business management,
Business management.
but then decided to go my own route as a business owner.
So we're gonna move on to your habits. So do you drink alcohol?
Occasionally.
Okay, just like a socially.
Socially.
Okay. How often would you say?
I'd say a glass of wine here and there every other week.
Okay. And do you have any history of tobacco use? This could be cigars, vaping, chewing tobacco.
No.
Okay, never in the past.
Occasionally on vacation or for recreational.
Okay. And how recent was that?
Well, I was just on a vacation 2 weeks ago, so yeah, it's not too long ago.
Okay. And when you were on vacation, did you do it every day, just once?
Just once.
Okay. And what kind of tobacco was it?
It was a cigar, a Cuban cigar.
Cuban cigar. Nice. Where'd you get it from?
Well, it was local. It was on an island in St. Martin's.
Oh.
Yeah, so.
That sounds fun. That was probably nice to get away from the cold
Yes,
here.
it was. Yes, it was.
Okay, so what about caffeine consumption? This could be the pop you drink, your soda, coffee, energy drinks.
You're asking me how many cups of coffee? Or?
Yep.
Say about 3 or 4 in a day.
Okay. And that's normal for you? You have that pretty consistently every day?
Yeah, pretty consistent.
Do you drink that every single day?
I like to drink that every single day, yeah. I
And-
try to keep consistent my caffeine intake.
Okay. And any recreational drug use?
No.
Okay. Ever in the past?
No.
Okay. And how would you say that your sleep quality is currently?
I'd say it's fair.
Fair? Okay.
Yeah.
How many hours would you say?
Around 6 to 8 hours.
6 to 8. Okay. And do you have any troubles falling asleep at night? Or?
No.
Okay. Do you ever wake up from your sleep with like night terrors or?
No, none of that nature.
Okay. And has your significant other ever said you snore at night or you stop breathing?
No, not that she's mentioned it or.
Okay. Do you use any devices to help you sleep, like a
No.
CPAP machine or? Okay. And I think you may have mentioned this earlier. Do you take any medications to help you sleep?
No.
Okay. And how is your exercise activity? What do you do for activity?
Oh, I like to weight lift and just walk on the treadmill.
Oh, awesome. How long have you been doing that for?
Ever since I was in high school, really. Yeah.
Weightlifting. So what does that consist of? What are you doing?
I'm doing free weights, weighted machines, typically low weight, high volume to get a sweat in. Yeah. So it's just something to get the body moving.
Mm-hmm. Did you just learn all that by yourself, or did it?
Well, you grew up. I played football myself, so you grew up in that culture of, lifting, and there's always somebody older who knows how to do the exercise. Yeah.
Okay, that's good. Yeah, we always recommend at least 30 minutes a day, but it sounds like you're got that covered. And you said, do you do cardio too?
I try to, yes.
How long would you say your sessions are when you go to the gym?
I would say anywhere between 45 minutes to an hour.
Okay, and you do that how many days a week?
I would say around 4 to 5.
Awesome.
Yeah.
Okay. Let's move on to, so I want you to walk me through like your typical day, just so I can get a better idea of how your lifestyle is of when you wake up to the time you go to bed.
Okay. I think when I wake up, typically in a day would be just get ready for work early in the morning, go to the office, have a cup of coffee there, go over the day, my meetings, paperwork, emails. I would say around 8 to 10 hours are typical my days in the office. Then I usually come home, brush off or get ready to go to the gym. And then I like to go to the gym at night, so that should take 45 minutes to an hour. By the time I get back, it's already time for bed.
Oh, perfect.
That's a typical day, yeah.
Okay. Even on, so is that Monday through Friday, and then our weekends kind of look the same, or?
Well, I'll say Monday to Saturday.
Monday to
And
Saturday.
then Sunday could be like, well, I don't really have a set time to get up, or
Just kind of like a leisure day to
correct.
go with
correct.
the flow. Okay.
Correct.
I like those days.
Yes, yes.
Next question is going to be about your diet. So I just want to know, can you tell me can you recall what you've had in the last 24 hours?
Well, I had breakfast in the morning. So this would be yesterday, right? 24 hours.
Yeah.
So I had breakfast in the morning. I usually just get a banana with some eggs, bacon, and a glass of orange juice, and then that should last me till around 2 p.m. And I'll have I had a ham and cheese sandwich with a couple of chips, and then for dinner I had a steak with broccoli and mashed potatoes, and I believe that's it.
Perfect. Did you drink anything throughout the day?
Water, a lot of water, and the occasional Powerade, Diet Coke.
Okay, sounds good. Is that your usual? Is that how your usual day looks? for
Yeah,
eating?
typical Monday to Saturday.
Okay.
Yeah.
And do you have any food? What am I trying to say? Do you have any special diet you follow? Like, do you try to do high protein? Are you gluten free?
Well, I typically like to stay high protein, not too many carbs, but definitely not limit myself to anything.
Okay, good. And how often would you say you go out to eat or go to a restaurant on a weekly basis?
I would say it's not too often, maybe once every other week.
Once every other week. Okay, sounds good. And regarding stress, how do you cope with stress or manage stress on your own?
Breathing exercises, and typically just try to not overwhelm myself in the first place, and just be as healthy as possible physically, to then be better mentally.
Yeah. I'm sure the exercise helps too with that.
Yes, it
and
does. It
the
does.
running.
Yes, it does. It does a lot.
Well, great. Have you ever had to seek like outside support, like a therapist or?
No, never.
Okay. And have you ever been exposed to violence?
No, none of that nature.
No? Okay. And how would you say what is your outlook on life? Are you satisfied with where you're at right now?
I believe so. I'm very happy where I am
Okay.
at this time.
Perfect. Are you working towards anything?
Just to live a prosperous life.
Good.
Yeah.
I like it. Safety. Do you wear a seatbelt regularly in vehicles?
Yes,
Okay. What about, do you ride a bike?
I do occasionally.
Okay. Do you wear a helmet?
I do.
Perfect. What about smoke alarms and carbon monoxide alarms? Do you have those in the workplace and at home?
Yes, I do, and we do. Yes, at the job.
Perfect. And any ownership of guns?
No.
Okay. How is your environment? Are you concerned about pollution, crime, smoke, like secondhand smoke, lead, radon?
No.
Okay. Perfect. What about your water supply? Do you have city water or well water?
It is well water, I believe.
Okay, sounds good. And your cultural and religious beliefs. Are you Christian, Catholic?
A Christian.
Christian, okay. And being a Christian, do you have any preferences for healthcare or want us to change anything?
No, not at all. I'm very happy where I'm at.
Okay, perfect. Now we are going to move on to the review of systems. So this is where I'm going to ask you a bunch of questions about your body. So we'll start with these questions. So have you noticed any fevers, chills, tiredness, or night sweats?
No.
Okay. Any weight changes recently?
No.
Okay. What's your current weight?
210.
Okay. And is this your usual weight?
That's been my usual weight for quite some time.
Okay. And are you happy with your weight?
I'm happy. I think I wouldn't mind being slightly under 200, but I'm happy where I'm at.
Okay. Okay. Now we're gonna move on to your skin and nails. Have you noticed any changes, or have you noticed any rashes or odd moles changing
No.
things? Okay. And what about your nails? Have you noticed any like lines on your nails or like thickness?
No, I have not.
Okay. Sounds good. Do you wear sunscreen regularly?
I do not.
Okay. Sounds good. So even in the winter, it's good to use sunscreen on a daily basis just on your face. Because even through your car window, you can
That is true. That is true.
Exposed.
That's a good tip.
So we'll move on to hair and scalp. Have you noticed any hair loss, itching, dandruff?
No.
Okay. No changes that have been concerning to you?
No.
Okay. And your eyes, do you wear glasses or contacts?
No.
Okay. So have you had an exam before?
With my eyes?
Mhm.
Yes.
Okay. Do you happen to know when your last exam?
It was when I was definitely in my teens, 2018, 2019. And no underlying issues. I've always had good vision.
Great. And I'm assuming that's the same because I was going to ask you about any vision changes or spots in your eyes. Okay, great. Let's move on to your ears. So have you noticed any hearing loss or like ringing in your ears or pain?
No.
Okay, no drainage or anything
No.
coming out. Okay. When you stand up, do you ever notice that you feel like the room is spinning or
Thankfully, no.
No, good. Okay. And I don't see any hearing aids. Do you wear hearing aids?
No, I do not.
Okay. Let's move on to your nose and sinuses. So it's cold season right now. Have you had a cold this season yet?
Thankfully, I have not.
Okay, great. Have you noticed any, you've been having any runny noses or bloody noses?
The occasional stuffy nose, but
Stuffy nose?
nothing what you just asked me, no.
Okay, no sinus pain or, okay, great. That being said, let's move on to the mouth and throat and oral cavity. When was your last dental exam?
Well, it was when I had that issue with my tooth back in 2022.
2022, okay. And since then, have you been back?
No.
No, okay. And any history of like cavities or?
No, zero cavities. Last time I met with the dentist.
Okay, perfect. You have the one front tooth on the right side?
Correct.
And it's just that one tooth that's
Just
false.
that one, yeah.
Okay. Have you noticed any when you're brushing your teeth, your gums are bleeding or anything?
No.
Okay. Any pain at all?
No.
And how often would you say you brush and floss a day?
I would say about 2 times a day.
Okay, great. Have you noticed any sores in your mouth or like having a sore throat?
No.
Okay, great. Any difficulty
It's okay.
difficulty swallowing?
No.
Okay, great. And then we're gonna move on to your neck. So have you noticed any like neck stiffness or like a decreased range in motion where it's like hard to turn your head or?
No.
Okay, great. And so like you have lymph nodes in your neck. Have you noticed any like lumps or like something out of the ordinary on your neck?
I believe not. I haven't noticed anything.
Okay, great. Sometimes you can get like lumps on the sides.
Oh, so it's just occasional. It's good to just check.
Mm-hmm.
Okay.
Exactly. Now we're gonna move on to your underarms and breasts. So have you noticed any lumps like under your underarms?
No.
Any drainage in any places?
No.
Okay. Any soreness anywhere?
No.
Okay, perfect. Now respiratory, have you had any coughs or mucus production lately?
No.
Okay. Any shortness of breath, wheezing?
No.
Now when you exercise, do you notice any shortness of breath?
Oh, no, I have not.
Okay. And then we kind of went over this earlier, but you don't, I think you mentioned no history of asthma,
No.
pneumonia, bronchitis.
No.
Okay, great. Cardiovascular, do you have any hypertension or your blood pressure is high?
Oh, no.
Any chest pain?
No.
Has anyone ever told you that they've heard you have a heart murmur?
No.
Okay. Have you ever been diagnosed with rheumatic fever? So that's like an untreated strep throat.
Oh, no, I have not.
No, good, okay. Any palpitations while you're exercising?
No.
Any like swelling in your lower legs?
No.
Okay. Any cholesterol issues where you've been told that?
No.
Okay, great. Any abdominal pain, nausea, vomiting?
No.
Okay, and how are your bowel movements?
They're pretty good.
Okay, do you have any diarrhea or constipation?
No, thankfully no.
Okay, and do you go pretty regularly? You would say? Do you have
Yeah.
to strain?
No, I would say like typical 2-3 times a day.
Okay, great. Have you noticed any blood in your stool?
Oof, thankfully no.
What about any history of like peptic ulcer disease?
No.
No. Okay. Gallbladder disease?
No.
Okay. Now we will go over urinary system. So, have you noticed any pain or burning when you go to the bathroom?
No.
No. Great. Any pains on your sides or back?
0.
Perfect. Blood in your urine?
No, ma'am.
Okay. Do you have any frequent accidents or bedwetting?
No.
Okay. And then do you ever, like when you're sleeping, is there ever a point where you have to get up to go to use the restroom?
No.
Okay. Great. Any history of urinary tract infections or sexually transmitted infections?
No.
Okay. Great. Any discharge from,
No.
okay. Now, we will go over your reproductive. So, do you regularly do testicular exams?
I do every once or twice every month.
Okay, good. It's always good to do that just to check. Better safe than sorry.
Correct. Yeah.
Do you have any fertility concerns?
No.
No. Okay, good. And have you ever had a prostate exam?
No.
Probably not. Okay. And then I'm going to ask about your sexual history. So, how many partners do you have right now?
Just one.
One now. Okay. And then number of partners in your lifetime?
Just 2.
2. Okay. And are these partners men, women, both?
Woman.
Women. Okay. Perfect. And do you use any condoms or form of birth control?
Yes.
Perfect. And are you satisfied with your sex life?
I am.
Perfect. We will move on to your musculoskeletal. So are you having any joint or back pain?
No.
Perfect. Any stiffness or swelling or weakness? Have you noticed any changes in like your range of motion or how you walk?
No.
Okay, perfect. And neurological, have you had any, well, you had that fall back
did.
at this Peak Sports Club. You hit your head when that happened. Other than that injury, has there been any other injuries?
Thankfully, no.
Okay, good. And you lost consciousness during that time. Has that happened again since?
No, it has not.
Okay, great. When you stand up, do you get dizzy at all or feel like?
No.
No? Okay. Do you have any numbness, tingling, anywhere?
No.
Okay. Any history of seizures?
No.
Okay. Headaches or memory or mood changes?
No.
Okay. And lastly, have you ever been diagnosed with anemia?
No.
Sickle cell trait
No.
disorder? Any bleeding disorders?
No.
Have you ever had any blood transfusions in the past?
No.
Okay, great. Have you ever noticed like that you have intolerances to heat or cold?
No.
Like your hands turn red or
No.
so? Okay, perfect. Have you ever had polyuria? So that's just like large amounts of urine.
Oh, no, no,
No. Excessive thirst.
no.
Okay. And excessive hunger.
No.
I've never noticed anything. Okay, perfect. So that concludes our full health history and review of systems. Is there anything else you want to discuss, or did I miss anything?
No, you're very thorough, and thank you so much for your feedback.
Okay, thank you so much. I look forward to our next visit.
Thank you, Miss Emily.
Thank you. Bye. Oh, I have to show this.
Good job, Emily.